Hi everyone, my name is Rose and my speech today is on coping with schizophrenia. Mental illness affects 1 in 4 Americans. There are many different types of mental illness, one of them being schizophrenia. Schizophrenia by definition is a severe mental disorder characterized by some, but not necessarily all, of the following features: emotional blunting, intellectual deterioration, social isolation, disorganized speech and behavior, delusions, and hallucinations. Schizophrenia affects the life of the person suffering, as well as the lives of those surrounding that person in many different ways, but does not have to stop a person or their family from living a normal life. The World Health Organization has identified schizophrenia as one of the 10 most debilitating diseases affecting human beings. Schizophrenia is a treatable medical condition. It includes 3 different types of symptoms: positive, negative, and cognitive symptoms. Positive symptoms are symptoms that don't normally exist in regular life, such as hallucinations, illusions, or delusions, hearing voices, or suspicions. Negative symptoms are symptoms that are a lack of symptoms that would normally be found, such as lack of emotion, lack of zeal, and lack of interest in life. Cognitive symptoms are symptoms that affect the thinking process of a person. It includes the inability to organize, inability to understand concepts, and problems with memory. Some mental illnesses, as well as drug use, can cause some of these symptoms, so it's very important that someone is properly diagnosed. These symptoms begin to appear in teens and early 20s, and sometimes later for women. There are 4 different types of schizophrenia. There's paranoid schizophrenia, which includes those positive symptoms; disorganized schizophrenia, which includes negative symptoms and some of the cognitive symptoms. There is catatonic schizophrenia, which exudes physical symptoms. And people that do not fall into one of these 3 categories are considered to have undifferentiated schizophrenia. Medically speaking, schizophrenia is incurable. However, it is a treatable medical condition that can allow a person to live a normal life. People are treated with medication and sometimes hospitalization and some sort of support system. For medication, antipsychotics are used to balance chemicals in the brain of somebody who has schizophrenia. Medications are only useful when they're used as prescribed and used properly. And of course, like most medications, they do have a side effect. A support system is very important with schizophrenia. Family and friends who are supportive and helpful and watchful for a person who has schizophrenia is very important. Being part of a peer support system of people who may have symptoms like schizophrenia but not necessarily schizophrenia, or people who do have schizophrenia, can be very, very helpful for a person. Individual therapy is also recommended. Hospitalization is sometimes necessary. In less serious cases, hospitalization is used for somebody who's gone off their medication. They're put in a hospital setting so that they can be observed and be put back on track on their medication. Hospitalization also occurs when somebody is not properly diagnosed and not properly medicated. They may continue to exude symptoms of schizophrenia or begin to have symptoms like schizophrenia because of medication. There's a high risk of depression in the schizophrenia population. There are a high number of suicide threats and attempts, and often when this happens, the individual will be hospitalized to be observed for their safety and for the well-being of others. Sometimes a caretaker who is caring for an individual is no longer able or available to care for them, and they may end up in a hospital. In more serious cases, individuals may need constant observation to make sure that they are not a harm to themselves or to others. When you realize that 2 million American adults suffer from schizophrenia, you may not seem that it's, or think that it's as small as it once seemed. However, when you realize that that is only 1% of the American population, it becomes very clear how isolating schizophrenia can be. It's isolating for the individual who suffers, and it's also isolating for the individuals who suffer along with them. For the person who's suffering, they have an inability to possibly hold close friendships because people may not understand how they feel or what they're going through. They also may have a problem with having just close associations or other relationships. They may have a hard time working and living in society as a normal person. However, with medical treatment and the support system, it is very possible for these people to live a very normal life. There's also an indirect effect on families and caretakers of these individuals. There's a financial effect when the individual is not able to care for themselves financially and the burden falls on their caretaker. There's emotional effect, an amount of isolation for the people who are caring for the individual because, once again, no one may quite understand what it is that they're going through. There's also guilt. Parents of people with schizophrenia may feel guilty that they've done something to cause their children to suffer this way. Other caretakers and friends and family may feel guilty because they can't seem to help or they may not be able to understand what the individual is going through. There's also physical and mental strain that goes along. However, with all of these things, it's very important to know that with treatment, support, understanding, and lots of prayer, there is certainly the ability to live a normal life for these individuals and for their families. According to a medication website, a number of famous people who are living with schizophrenia have achieved their goals while living with the illness. These include a Nobel Prize winner, a Broadway star, a writer, and a jazz composer. Schizophrenia is a complex disease. It has many different facets. It has many different symptoms, many types, and many possible outcomes for the individual and for those who care about them. And while it affects their life and the lives of the people surrounding them, it does not have to stop that person or their family and the people that love them from living a normal life. Thank you.